Ma'am, we will be taking the presentation alongside the discussion, which is on the topic of good nutrition for the elderly. So if you can speak along and turn your video and audio on.
Hello. Just a minute. एक मिनट. वीडियो हो गया मैम? अभी क्लियर है मैम? हाँ, ठीक. Okay.
So ma'am, please take us through the discussion.
Very good afternoon. Today's topic is nutrition during old age.
Sorry, can you please speak a little more loudly so that it is audible very clearly?
Is it clear?
Yes, better.
Okay.
Please go on.
Today's topic is nutrition during old age. Old age basically is the best defined as age of retirement, that is 60 years and above. Nutrition for old age is known as geriatric nutrition. Aging brings psychological, physiological, and immunological changes which influence the nutrient status. Now, come to the geriatric nutrition, the branch of the medicine dealing with health problem, the elderly, for example, delaying the onset of severely degenerating aspects of aging and treating the disease of the aged. Gerontology, board area of science concerned with the psychological, social, economical, psychological, and mental problem of aging. Changes associated with the aging, psychological changes, socio-psychological, physiological changes, socio-psychological changes. Physiological changes is loss of teeth, decreased neuromuscular coordination, impaired hearing and falling. Psychological changes is diminished sense of taste and smell, anorexia, physical discomfort. Physiological changes is changes in body composition, change in gastrointestinal, change in cardiovascular system. Physiological changes is change in respiratory function, change in renal function, change in skeletal tissues. Psychological changes is food habit, economic aspects, loneliness. Psychological changes is also lack of nutritional knowledge, depression, anxiety. Next is loss of self-esteem, loss of independence. Nutritional requirement for elderly is energy requirement reduces, basal metabolic rate decreases due to reduced muscle mass and other metabolically active tissue mass, reduced physical activity, increase in fatty tissues. Male and female, sedentary male 1883 kilocalorie and moderate male is 2216 kilocalorie and female 1706 kilocalorie and moderate 2007 kilocalorie. Carbohydrate requirement is requirement reduces, impaired glucose intolerance can lead to hypoglycemia, hyperglycemia and type 2 diabetes mellitus. Insulin sensitivity can be enhanced by balanced energy intake, weight management and regular physical activity. 50% energy should derive from carbohydrate. Protein requirement, decreased skeletal tissue mass, decrease in store of protein is inadequate to meet the need of protein synthesis. Intake of 1 gram per kg is safe during old age. Protein-rich food with milk and curd should be included. Due to decreased appetite and poor digestion, old people consume less protein, which may lead to edema, anemia, and low resistance to infection. Lipid Dementia and CVD may share risk factors like high intake of dietary total fat. Emphasis should be placed on reducing intake of saturated fat and choosing monosaturated or polysaturated fat sources. Sufficient intake of W3 fatty acids help in visual acuity, hair loss, tissue inflammation, improper digestion, poor kidney function, and mental depression. Minerals. Calcium 800 mg per day to compensate age-related bone loss, to improve calcium balance, and to decrease prevalence of fracture. Calcium absorption efficiency decreases, vitamin D level decreases, so need more calcium. Total food consumption decreases, so calcium supplements needed. Iron 30 mg per day. Deficiency is seen in elderly due to inadequate blood loss due to chronic disease or reduced non-hemoglobin iron absorption. Vitamin C deficiency also reduce iron absorption. Mild anemia affect health due to less efficient circulation of blood. Zinc. Some features like delayed wound healing, decreased taste sensitivity, and anorexia are associated with zinc deficiency, but healthy elderly don't show zinc deficiency. Vitamins. Elderly are at risk of vitamin deficiency due to decreased exposure to sunlight or decrease in renal mass. Dietary supplements with calcium and vitamin D improves bone density and prevent fractures. People with Parkinson's disease have low vitamin D levels. Stress, smoking, and medication can increase vitamin C requirement. The antioxidant vitamins such as vitamin E, carotenoids, and vitamin C enhances health of elderly. Vitamin C may be protective against cataract at an intake level of BW 150 to 250 mg per day. Vitamin E is potent nutrient for reducing decline in cellular immunity that occur in elderly. Changes in immune system to be overcome by taking 200 mg of vitamin E. Requirement of vitamin B6 is B3 due to atrophic gastritis, interference with absorption. Alcoholic and liver dysfunction are additional risk factor for deficiency of vitamin B6. Vitamin B6 have significant role in immune system. Alcoholism is a risk factor for folate deficiency. Severe deficiency of folic acid may result anemia and elevated serum homocysteine level, which is a risk for cardiac disease. Consumption of folate rich food is needed. Causes for vitamin B12 deficiency are atrophic and bacterial overgrowth, which decreases absorption and leads to pernicious anemia. Nutrition-related problems among elderly: obesity, undernutrition and malnutrition, osteoporosis, cardiovascular disease, diabetes, and cancer.
Thank you so much, ma'am, for such an insightful PPT. I will stop the presentation now and we will take up one-on-one discussion. So can we please have your video turned on so that we can have the talk show now and discuss a few different aspects that you showed in your PPT. Yes. So moving on to the topic, which is nourishing foods for the elderly. You showed us how different vitamins and minerals are very important for the overall good health and well-being of those in the elderly. But in your practice, we would like to know that in your practice, what are the most common, problems that you face that elderly people are facing? What are the top 3 or 4 most common diseases or health issues that elderly people come to you with? And how can they be easily solved through if they are following good food and nutrition? We would like to know your views on that.
My views is actually most of the elderly patient is deficient from vitamin D and iron, and most common disease is obesity, obviously. Elderly patient because of lack of movement, lack of physical activities, and obviously, if I come to the point of disease, so most common disease is diabetes.
Ma'am, can we have your mic more closer to you so that we are able to listen and our audience is able to listen better? Yes. So as you explained, the very common health issues or health conditions that patients come to you of old age are suffering from either vitamin D deficiency, calcium deficiency, iron, obesity, and also the last point that you mentioned was, is it heart diseases?
Diabetes.
Diabetes. Okay, diabetes and obesity being the top. So, ma'am, as we are talking about good food and nutrition, and this year has been classified as International Year of Millets. So, what, in your opinion, can we recommend, old people? How can they incorporate millets in their diets? Because these grains, these superfoods, also some millets also come into the superfoods category. So how have you observed? Is it good for old people's health? Is it good to, incorporate this to help with their iron deficiency, anemia, or bone deficiencies that they are commonly suffering from?
Yes. Millets is not only good for elderly people. Millets is good for all age groups because millets is a nutritious millets in which you can say all type of nutritions is there in millets, like vitamin D, like calcium, like minerals, like iron. So millets is good for all age groups, and millets बेसिकली आप ये भी कह सकते हैं कि मिलेट्स इज गुड फॉर गैस्ट्राइटिस पेशेंट दैट दिस इज वेरी कॉमन डिजीज फॉर सेडेंटरी वर्क स्टाइल पीपल.
Definitely, ma'am. And as old people are advised to move more, but they do not have as much physical movement as they used to while in their working years. In old age, their physical activity also is hampered to a great bit because of some mobility issues or heart issues or something, other allied health issues. So definitely recommending them with millets, as you said, is a good option. Also, can we have specific food items that old people should focus on so that they are keeping themselves on the top when it comes to, their bone health or the health of their teeth, or not, be having healthy, levels of hemoglobin in their blood and stuff? So are there any specific food items that can be recommended?
Recommended food is milk, good source of vitamin D and good source of calcium. So recommend milk and milk product.
So any apart from that, if we were to, advise a healthy plate of food to an old age specific person, I mean, an old person. So what would be the old age specific, a plate for healthy meals look like? How much of what should be prioritized according to you?
Actually, a healthy plate is healthy plate, you can say a healthy plate in which you can eat all types of food, like carbohydrate, like protein, like fat, like milk and milk product. All these type of foods are available in one plate. So you can divide into percentage, like 60%, 40%, 20%, like ऐसे भी आप divide करके एक plate को ready कर सकते हैं.
Okay, can you please elaborate what this 60%, 40% is for our viewers who are not aware?
Like if you are eating most of the Indian peoples are concentrate only on carbohydrate like roti, rice and all. So you can divide in proteins also, like dal, green vegetable, salads, dahi, मतलब curd, milks. तो you can divide into it. तो 40% आप कार्बोहाइड्रेट ले सकते हैं, 10% आप फैट ले सकते हैं, 20% आप प्रोटीन ले सकते हैं. तो यू कैन डिवाइड इनटू इट.
सो मैम, जैसे ज्यादातर जो बॉडी बिल्डिंग वगैरह कॉन्शियस लोग होते हैं जो जिम वगैरह जा रहे
यस.
होते हैं, दोज आर इनटू देयर अर्ली years of age, 20s or
यस.
30s, and are very conscious about their bodies. They are advised to take more of protein or good
यस.
amount of protein as per their body weight. So is there any specific recommendations of protein intake for the elderly people as well? If so, can you please explain what they are?
Elderly people, basically 1 gram protein is required for 1 gram per body weight is required for all persons. But हमारा जो इंडियन फूड हैबिट है इसमें 1 ग्राम प्रोटीन पर बॉडी वेट फुलफिल नहीं ही हो पाता है फॉर एवरी पर्सन, फॉर वेज फॉर नॉन वेज. तो जो भी जिम जाने वाले पर्सन है फिजिकल एक्टिविटी को मेंटेन करते हैं तो एटलीस्ट उनकी बॉडी वेट के हिसाब से उतना प्रोटीन तो उनको रिक्वायर्ड है. लाइक अगर 60 kg के तो एटलीस्ट वो 70 kg तो ले, बट अगर वो वर्कआउट करते हैं तो 70 kg इंटू 1.2 ग्राम प्रोटीन की रिक्वायरमेंट उनको होती है.
Okay, so you mean to say that old people are also advised to take in a good amount of protein as per their requirement. As in, one reason could be that in old age your body deteriorates at a faster level, and regeneration is slower than compared to the younger age groups. Hence, it is advised to take these nutritional protein shakes or clinically recommended or dietitian say recommended protein supplements and everything for old age specific people. Also, ma'am, one thing that we would want to know is that most of the old people suffer from digestion related issues. I clearly know that my grandparents in my family had this big issue of whatever little they are eating, but they're not able to digest it well. Hence, they had big issues in passing proper stools or proper motions for that matter. And they had to take these added supplements for improving digestion. So can we have some recommendations from nutrition point of view that these food options should be incorporated in old people's diet so that their digestion is, maintained properly?
For क्या वीडियो ऑफ हो गया? For old age person, actually problem is that ना for old age person उनकी physical activity भी कम हो जाती है और ओरल इनटेक कांस्टेंट होने की वजह से फूड डाइजेशन प्रॉपर नहीं हो पाता है. तो first is that small frequent meal means 3 big meals in between 2 small meals, so you can add into it. And before retiring, before bedtime, 1.5 hour before you can take your dinner so that proper digestion हो सके. And after dinner, after 25 minutes or 30 minutes after dinner, एक brisk walk बहुत जरूरी है 15 और 20 मिनट्स का, सो दैट जो रात का खाना है वो भी इजीली डाइजेस्ट हो सके. एंड प्रोटीन रात डिनर जो है वो हमेशा लाइट होना चाहिए एंड ब्रेकफास्ट प्रॉपर. लंच आप थोड़ा माइल्ड रख सकते हैं. एंड एक प्रॉपर मील गैप होना बहुत जरूरी है, लाइक 3 hours 2.5 to 3 hours का एक मील गैप होना उनके डाइट में बहुत जरूरी है.
Thank you so much, ma'am. Also, we would like to discuss that as with old age, old people reaching that age suffer, start developing various other lifestyle related diseases as well. One of which you suggested was obesity and diabetes. So there are so many old people that, at least 60% of old people not just suffer from one disease, but have a problem of multiple diseases altogether.
Yes,
So
of course.
what kind of nutrition plan we would recommend for a very classic case example, which is an old person above the age of 75 having, taking heart medications for cholesterol, or for anticoagulants for that matter,
Yes,
is
ma'am.
on this kind of medication, is suffering from diabetes, and hence taking either oral or injectable insulin, and
Yes.
diabetes medications, and is fairly lightly moderately overweight or slightly obese. So what should be the ideal diet should be for this kind of person? Should they worry about counting calories, or reducing their caloric intake for losing weight or stuff, or should they focus on gaining proper nutrients through their diet, or not worry about losing weight or whatever? How would you go about solving dietary needs of this kind of a person?
Actually, this is all lifestyle disorder. Like diabetes is lifestyle disorder, obesity is also lifestyle disorder. So my suggestion is that if you are suffering from diabetes, if you are suffering from obesity, you first you should maintain your lifestyle, like proper sleep, proper food, stress, to maintain your stress level also. तो अगर आप अपने लाइफस्टाइल को ठीक करते हैं तो ये सारी चीजें अपने आप ही ठीक होती हैं। और डाइट डाइट बेसिकली ओल्डर पीपल और जो भी पेशेंट टाइप पर्सन है, लाइक डायबिटीज और जो भी ओबेसिटी के हैं, उनमें है अपने कार्ब्स लेवल को कम करना, कार्बोहाइड्रेट के फॉर्म में डाइट को कम करके प्रोटीन का लेवल अपने डाइट में बढ़ाना है। एंड sugar sugar is also not good for any person, not good for, also not good for children, not good for elder person, and not good for also diabetic patient. तो प्रोसेस्ड फूड इसको अवॉइड करना है, कैंड एंड बेकरी फूड को अवॉइड करना है, अल्कोहलिक बेवरेजेस अवॉइड करना है। तो ये सब बेसिक चीजें अवॉइड करेंगे एंड लाइफस्टाइल को ठीक करेंगे।
Thank you so much, ma'am. And ma'am, as food is a very integral part of Indian culture, we see, during festivals, there are lots of sweets around, lots of fried goods around, puris and all these things, halwa, etc. So there are so many, alternative options that are coming in the market, which is sugar-free cake or sugar-free biscuits or etc. So what would you recommend? Are these sugar-free alternatives of Indian sweets, etc., which are having, alternatives of sugar, are good for old people's health, or is it just as bad to consume, something like that? What would be your, opinion on this one?
No, sugar free sweetener is not good for anyone. So personally, I do not recommend sugar free.
So how can
In
they?
place of sugar free, you can use jaggery, you can use stevia. Stevia leaves is also available, so you can use stevia leaves. But I personally not recommend sugar free powder or sugar free tablet.
Because
Once in a blue moon you can use, once in a while you can use, but not on regular basis.
because the old people have their habits very fixed, whatever they
Yes.
have been following in their life, they like to stick to that. And at that very age, in that very old age, if you tell them to make any sort of lifestyle or personal modifications, कि आप चाय
Yes.
बंद कर दो या आप चाय में चीनी बंद
Yes,
कर
of
दो,
course,
so,
this is not
so
possible
they
for anyone.
repel a lot. They are like, I don't want to change how I have been living for these many years, and I don't want to follow your diet. So what can be the recommendations for them, the old people who are suffering from obesity and diabetes very particularly, and need to reduce their sugar intake or added table sugar intake? So what recommendations would you suggest these patients?
सी पर्सनली किसी भी पर्सन का फूड हैबिट को सडन चेंज नहीं करते हैं हम। हमारा ये कंसर्न होता है कि ग्रेजुअली उसको चेंज करना है। लाइक अगर कोई पर्सन है जिनको शुगर लेना बहुत अच्छा लगता है तो वो शुगर लेंगे, बट उसकी क्वांटिटी को लिमिट में कर देंगे या उनकी क्वांटिटी को थोड़ा लेस और ग्रेजुअली उनकी क्वांटिटी को कम करते हुए बंद करना है।
Yes, similarly, the way we recommend to anybody who is trying to quit smoking or alcohol, that reduce it in the starting and then
Yes,
slowly cut out the times that you are consuming it. So similarly, that way we can have the recommendation. Ma'am, another very important aspect is that we face, old people suffer from, is bone related issues. जोड़ों में
yes,
दर्द हो रहा है,
हाँ,
this and that. And in many ancient traditions or different cultures, it is recommended that uptake of ghee and other such, elements of food items would help in your bone and joint function. So can you please help us understand clinically, what do dietitians recommend? Is uptaking, spoonful of ghee every day in part of your diet a good thing to do for old age? Do they do this? Do consuming essential fats actually help in the bone and joint health of old people, or is it just a myth?
just a myth. Joints, matlab, ghee is ghee and butter. Basically, it is not. This is myth actually. It is not good for bone health. Bone health के लिए required है good source of vitamin D and calcium, and you can take it from milk and milk product. But fat is not required for bone health. So normal fat they can use like 20 ml fat is required for elder patients or elder persons. So 20 ml fat is good for them.
So, ma'am, would you recommend for elder people incorporating nuts in the diet on a daily
Yes,
basis? And if
yes, of
so,
course.
what nuts
But
in specific and what quantity would you recommend?
older age patients they can eat almonds, they can eat walnut, but quantity is fixed. Like if they can eat almond, to 4 and 5 almonds is more than enough for them, and soaked almond, and 2 walnut is more than enough for them. And they can use only fig, to they can eat fig, soaked fig. So 2 figs and 2 almonds, 4 almonds and 2 walnuts is more than enough.
For an adult male.
Yeah.
Okay. So, ma'am, you have mentioned clearly to incorporate soaked nuts and soaked almonds, soaked figs.
Yes.
So, how does soaking it helps, as compared to having normal nuts and normal figs? Does it have any additional benefit? We would like to know.
एक्चुअली शोक फैट, जब भी हम किसी चीज को शोक करते हैं ना, तो न्यूट्रिशन जो एक जैसे फैट का लेवल है वो उसके वाटर में आ जाता है, तो आपको जो प्रॉपर न्यूट्रिशन मिलना है
Ma'am, your
वो उसके
audio is very less.
उसके
Can
नट।
you please keep the mic up? Yes,
हाँ,
please.
शोक्ड करने से जो उसका फैट का लेवल है, क्योंकि वो भी एक ड्राइड नट्स है ना, तो फैट तो अवेलेबल है उसमें भी। सोक करने से उसका जो फैट है वो उसका फैट का कंटेंट जो है वो रिड्यूस हो जाता है।
Okay, so by reducing the content of that, it is easy to digest, is it?
Yes, yes.
Okay, okay. And these patients being elderly, all the help that we can give for easing their digestion is a must. So, ma'am, another question, which is our last question for the session for you, is many, old people swear by taking isabgol. So I don't
Yes,
know, the isabgol is a trade name, of course, but Psyllium
yes.
husk, which is commonly available in any sort of brand name, is very commonly taken by all old age people, and many doctors recommend that as well, that if you are having any problems with passing regular stools or good enough stools, take Psyllium husk in at night, and you would have better go. But ma'am, we have also seen that some patients who have these problems of either celiac disease or something like lactose intolerance or any sort of nutritional problems or these allergies that they have nutrition related, are not able to handle physical psyllium husk themselves. So are these two related? Is it a good option to recommend psyllium husk as a natural alternative for healthy pooping? What would be your opinions on this?
फर्स्ट ऑफ ऑल हमने पहले भी अभी जब हमने स्टार्ट किया था क्वेश्चन सेशन, फर्स्ट क्वेश्चन मिलेट्स से था. तो मिलेट्स इज गुड सोर्स ऑफ फाइबर. तो मेरा फर्स्ट कंसर्न है कि फाइबर रिच डाइट लाइक सैलेड, लाइक कैरेट, लाइक बीट, they are eating fruits like pomegranate, like orange. तो अगर वो जितना ज्यादा फाइबरस फूड लेंगे, स्टूल अपने आप ही नॉर्मल और क्लियर होने लगेगी. अगर क्रोनिक कॉन्स्टिपेशन है, उस केस में इस गोल जो लेते हैं वो उस केस में वो ले सकते हैं. कोई साइड इफेक्ट उसकी नहीं है.
That is good. Thank you so much, ma'am, for sharing this.
Thank you so
Also, thank you so much for presenting a very nice presentation in the beginning. You were able to cover all different aspects around nutrition related to the old people, the elderly. We would like to thank you, dietitian Ms. Priya Dubey, for taking out time from your busy schedule and imparting us with wealth of knowledge and information around this topic for the Good Food Talk Show. Thank you so much.
Thank you so much, ma'am.
We would also like to thank our partner in the activity, JB Chemicals and Pharmaceuticals, for partnering with us on this very insightful topic for the discussion for today, Nourishing Foods for the Elderly. Thank you so much, JB Pharma. We would also like to thank all our audience who have been following us for the Bharat Nutrition Week 2023. Thank you so much for watching. Please stay tuned for all further episodes in this series, as well as the other series that IHW Council is doing all around good health. Thank you so much. With that, we sign off now. I, Dr. Asabri Sawant, Public Health Specialist for IHW Council, wish you a very good day. Thank you so much. Stay happy, stay healthy. Bye-bye. Thank you, ma'am.